Good morning, guys, or whatever time it is, wherever you're watching from. My name's Dr. John Evans, and I'm with You Fix Pain. And today we're going to be going over different hamstring stretches and techniques you can do to get hamstrings to calm down. I tweaked my hamstring about a week ago. I was playing tennis with my brother-in-law and flared it up pretty good. I actually felt a pop, and I kept playing through it. Probably not the best idea to do, but anyways, I kept playing, and then it was really sore. So I'm gonna show you guys exactly what I did to get it to calm down and pretty much resolve 90% within 24 hours. So I think it works pretty well. Typically, when someone tweaks their hamstring like that, they're going to be out for about 2 weeks, depending on what they do and what kind of rehab they have going on. I'm going to show you guys how to cup. I'm going to show you guys my favorite stretches for the hamstrings, and then we'll take it from there. So, one thing I want you guys to know, whenever you tweak your hamstrings here in the back, you're going to feel a nice, sometimes you'll feel a pop, but a lot of times you're actually going to feel um, some pressure up in your bum. And then sometimes you'll feel it actually all the way down behind your knee. Now, with my hamstring, I actually tweaked it right here in the mid belly of the hamstring. And so the further down your hamstring, it's actually better because then it's in the meat of the muscle. So just keep that in mind that when you tweak your hamstring, it's going to take longer to heal if it's closer to your bum. Now, if it's more in the meat of the muscle, then it's not going to take as long to heal typically because it has more circulation and more blood flow. So just keep that in mind. But so what I did to start was I cupped it. You can look up cupping online. There's a lot of people that frown upon it. Even if you look on Wikipedia, people are going to say it's wacko. But I will tell you, I've used it a ton with patients. I was skeptical too at first, but man, this stuff works. Now, you don't want to do it if you have an open wound, if you have diabetes, if you have any type of blood clotting disorder or any type of like high blood pressure. It's really safe, but if you have an open injury or underlying blood condition, then you don't want to use cupping. But it's really safe, and I do it all the time with patients, and it works really, really well. So I've got this fancy little cupping gun. You can get these on Amazon for like 35 bucks. And what you want to do is first put on lotion so it doesn't rip off your skin. Nobody wants that. So what I'm going to do is, so this is the hamstring that I tweaked last week, and I haven't cupped it since. I worked out this morning, so my leg's a little tired, and I can still feel it just a little bit. Like I can feel it right in there. And so what I'm going to do is I'm going to put these cups on there, and I'm not going to put them on for more than 2 or 3 minutes. And I'm actually going to move while they're on there. So some people would call this dynamic cupping, and some people would just call it cupping. Some people call it really anything they want. But I'm going to get these puppies on there pretty tight. It's pretty gnarly. It's not meant to feel good. I'm going to give it about 3 full clicks. Now, keep in mind, this does not feel good. And you can see the skin pulled up in there. And what I encourage my patients to do and what I do is while they're on there, I'm going to be doing squats. So the whole premise of cupping is you're going to get that fascia underneath your skin pulling away from the underlying tissue. So you're just getting more circulation in the area that's injured. And the more circulation means more nutrition from the blood flow and more oxygen from the blood flow. And that leads to quicker recovery. So what I'm going to do is I got these puppies on there. Now I want to pay attention to the color of them. If they start turning dark purple really quick, then I don't want to leave them on there for much longer because it's going to cause excessive bruising and you don't want to over injure that area. So what I'm going to do is I'm going to leave these on there. Then I'm just going to start doing some free weight squats or body weight squats. And that does not feel good at all. I'm going to shoot for about 10 of them. And it's just pulling big time right on where the injury was. And I'll tell you, when I first injured my hamstring and I put these on, it actually felt pretty good. So I'm just trying to get moving. It doesn't really necessarily matter what you're doing as long as you're moving. Now, I'm going to do about 1 or 2 more. And now I'm just going to walk back and forth for about another 30 seconds. I'm keeping an eye on the color of them. And as you can see, they're starting to change a darker color, particularly that one. So what that means is either you've got the pressure tighter there or that tissue is more stagnant. And when I say the tissue is more stagnant, it means that it needs more work. The area is just really bound up, and the more you work it out, the better you're going to feel. So just pacing back and forth. Once again, I'm trying to keep that leg moving with those cups on there. I'm going to do some more squats, do maybe like 10 more. And once again, this does not feel good. You should be able to tolerate it, but it shouldn't be more than like a 6 out of 10 pain, 10 being the worst. All right, let's see how those look. All right, so at this point, they're a pretty good dark color. All I'm going to do is pull this pin off. And as you can see, I got a nice little circle there. Looks like I got stung by an octopus. Now that one's probably not going to bruise, but this one will probably bruise pretty good over the next 24 hours. Totally normal. Bruising's fine. Don't be surprised if you do bruise, if you do cupping. It works really well. Might be a little tender to the touch, but it's totally worth it. Like my hamstring feels loose already. So then what I'm going to do is I'm going to follow it up with getting all that lotion off. I'm going to follow it up with some stretches. So there's a couple different dynamic stretches that I do that I'm a huge fan of, and this is best bang for your buck. Nobody really likes stretching. It's pretty boring. It's therapeutic, but to me, it's just really boring, and I don't like doing it that much, but I know I need to. So what I'm going to do is I'm going to do an inchworm. Make sure you guys can see what I'm doing here. So I'm going to keep my legs nice and straight, and I'm literally just leaning straight down, and then I'm going to crawl out forward the whole time. I'm not trying to bend my legs at all. Now, my hamstring that got tweaked was my right one. So I'm going to keep it as straight as possible, try to keep my heels on the ground, and I'm just going to crawl out, and I'm just going to go all the way out. Try to keep those heels down to the ground as far as you can, and then just coming right back up. I'll try to swing my arms a little bit. I do this every time before I work out. I'm going to do that about 10 times. I'm going to come back down into it. And already I feel like I can get further into that stretch, which is fantastic. So I'm going to go down into it, almost touching the toes now, and then crawling back out. Try to keep those heels down, and then coming back up. And I'm going to keep doing that. I'm going to make sure the sound's working on this thing. Hopefully you guys can hear me all right. All right. Same thing, feet are about shoulder width apart, leaning down. If you can see, I'm actually touching the floor now, which is pretty amazing. And then coming back out, I've never naturally been flexible. And then coming back up, once again, keep those heels down, those knees locked out. Coming back up, I'm gonna do 2 more just for time's sake. Coming down, crawling out, keep those heels down, those knees locked. Drop those hips, come back up. All right, let's do 1 more. I'm feeling that hamstring loosen up more and more. My fingertips are now pretty easily on the ground, which is a great sign. Coming out, and then coming back up. Now, if you've had a hamstring injury that's been going on for several weeks or months, it's going to take more than just a couple of stretches to get it to calm down. What tends to happen is you have muscle memory in your body, and your body just adapts to different injuries. And so something you want to keep in mind is that if you've had an injury for a long time, you're going to have a longer rehab process. And with that, the more aggressive you are with doing manual techniques to get more circulation in that area, more blood flow, and doing more to expedite your recovery, the quicker recovery you typically have. Now, cupping, stretching, all these different things that I'm doing isn't a magic cure for everybody, but it's what I've found to be really effective over the last 12 years of treating patients. So, all right, the next stretch that I'm a huge fan of is this one. Move this stuff out of the way. Okay, so my right hamstring is the one that's tweaked. And so what you want to do is you want to get on a hard surface like this table. And you can use the side of your bed, you can use a coffee table, whatever works for you. Now, what I'm going to do, my right leg is the injured side. So I'm bending this leg up and I'm putting this leg behind me as far as I can. Okay. Now, if you notice, I'm going to get a pull here in the front, but I'm also going to be getting a pull in my hamstrings. And this stretch is amazing because not only stretches my hip flexors and mainly my hamstrings, but it actually also loosens up my sciatic nerve. So this is called a nerve tensioning stretch and a hamstring stretch all in one. So why does it matter to stretch out your hamstrings and your nerves? Well, I'll tell you a story from when I was in PT school and physical therapy school. one of my friends was pretty flexible, except she couldn't touch her toes. But she stretched and stretched and stretched, and she never got much progress with her hamstring length. But then we learned about nerve tension, and she started focusing on loosening up her nerves. And then she started getting a lot more mobility in her hamstrings. So, nerve tension, ultimately, what it means is your nerve is like a wire, and that wire has a coating around it, just like your nerves do. And you can get adhesions along that nerve, and it can commonly mimic tight muscles when in reality it's just your tight nerves. So I like to loosen up both, and that's what I'm gonna show you guys how to do. So once again, bad legs up, using the side of your bed. This leg's behind you. Now, what I'm doing is I'm gonna put my right hand on, not on my knee, but right on my thigh, and I'm gonna reach with my opposite hand, and I'm gonna go on the outside of my foot, and I'm gonna push down through my thigh and pull back on the outside of my foot. At the same time, I don't hold it for more than 3 to 5 seconds, and then I come out of it, and then I just go back into it. So I'm pushing down to try to lengthen out my leg while keeping this leg back, and then I'm pulling back on my outside of my foot at the same time. So I'm going to push, pull, keep my shoulders upright, and then I relax. Don't come out of it all the way, just a little bit. Push, pull, relax. Once again, I'm pushing down through my thigh, pulling back on the outside of my foot. Push, pull, keep that leg on the ground further back. You should be feeling a huge pull up through here. Sometimes you'll feel a little bit in your back. Most people feel it in their calves or in their hamstrings. Let's do it a couple more times. Push and pull and relax. Now I'm trying to straighten out that leg a little bit further. Push, pull, and relax. Let's do one more. Push, pull, and relax. Okay, now you stand up and just walk out. If you were my patient, you just tweaked your hamstring, I'd have you do that about 30 times after we did the cupping. And already I'm feeling good mobility. I was doing some squats this morning and deadlifts, and I could feel it pulling on my hamstring just a little bit. It didn't keep me from doing the exercise of the workout, but I felt it enough to know that I still had some work to do. So, like I said, when I did these within a couple hours after I tweaked my hamstring last week, I was 90% better. So the fact that it's a week later and I really haven't stretched it since, as I told you guys earlier, I hate stretching. I should be stretching it every day, but I only feel it about 10%, and that's if I'm lifting pretty heavy weight. So it definitely works pretty well. So those two stretches work really well. Now the third one that I do is it's a lot more simple. I'm literally just throwing my leg up like this, try to get this leg behind me, and then I'm just leaning into it, and I'm going to hold it for 30 seconds. Okay. Now when I'm leaning into it for 30 seconds, I can lean more medial, more in towards my groin, or more out to the outside, and I'm going to just lean in the direction where I feel it pulling where that injury is the most. We want that to feel like a nice medium grade stretch. You're not trying to rip your leg off. You're not trying to cause a ton of pain, just a medium grade stretch. Because if it's too much, your body's going to tense up and not allow you to stretch out as much. If it's not a stretch at all, then you're not going to feel much. You're not going to make much progress. So when I say medium grade stretch, you're looking for like a 4 or 5 out of 10 in terms of pain or discomfort. And I tell you guys, I normally can't touch my toes, but just that cupping and those other two stretches, it really loosened me up. So I'm just focusing on deep breathing while I'm doing the stretch. I breathe in through the nose, out through the mouth, trying to make that breathing out last as long as possible and the breathing in last as long as possible. So just breathing in and out and leaning into it. I'm going to turn my toes in a little bit. Oh gosh, I feel that even more in the back of my hamstrings. And then I'm going to relax. Now, I would do 5 sets of that, and then try doing whatever movement you did before that caused you a lot of discomfort. And what you'll find is typically is after you do each one of these stretches, you're going to get more mobility and less pain with whatever movement caused you pain before. So it works extremely well, and I'd highly encourage you guys to take a look into doing these stretches. You've tweaked your hamstring, and just remember, pay attention to your body. Everyone's different. This isn't a cure for all, but it does work really, really well. Loosen up your hamstrings and just pay attention to your body. If it's telling you it's feeling good, then do it. If you're getting sharp shooting pain, it doesn't feel right, just stop. But I'm here every Wednesday, 9 a.m. Eastern Standard Time. I'm here to help you guys get better, answer your questions. Please take advantage of these live sessions because I am here for you and trying to do everything I can to teach you guys on how to fix your pain on your own from home. And till next time, we'll see you guys next Wednesday.